welcome back to the session developmental anomalies. We have discussed the basics in developmental anomaly, and we have seen that developmental anomaly can occur in any part of your face as well as your head. Okay, so in this video, we will be discussing about the developmental anomaly of the jaw, in which examiner's favorite question that is about a PARRY-Romberg syndrome. Okay, so in this video, we will be discussing a little about syndromes, PARRY-Romberg syndrome, and a little about Pierre-Robin syndrome. Okay, so this is a favorite university level question that you will face. Now, coming to the video. So as always, we start with the table of contents. In this also, we will be discussing about the introduction, etiology. What is the reason for this PARRY-Romberg syndrome? What are the clinical features? How you manifest this PARRY-Romberg syndrome, and its treatment and prognosis. Now, let's see. So Parry-Romberg syndrome, as you all know, as it's a syndrome. So syndrome come in a group. Okay, syndrome are diseases which come in a group. There are 2-3 diseases coming together. Okay, when the 2-3 diseases are coming together or associated together, they are called a syndrome. So what's there in Parry-Romberg syndrome? Okay, it's very easy to remember. We have hemifacial atrophy. One side of the face, okay, is small, atrophy. By the meaning atrophy, it means it is getting smaller. Okay, so contents on one side of the face is getting atrophied, okay, on one half of the face, and that patient will have epilepsy, episodes of epilepsy or seizures, and the patient will have trigeminal neuralgia. Okay, so one side of the face is getting atrophied, the patient is getting epilepsy, and the patient has trigeminal neuralgia. When these three things come together, that condition is called Parry-Romberg syndrome. Okay, so what you see here is that we see atrophy of tissues on one side of face. You know what is meant by atrophy. It means the tissues on one side of the face is getting atrophied or getting small. Okay, so or it is wasted. Okay, it is getting wasted. The muscles, skin, fat, the gland on one side of the face, the tooth on one side of the face, all are small and atrophied. Okay, and it is a localized form of scleroderma. Scleroderma is a systemic disease that occurs whole of the body. I mean, scleroderma affect any part of the body. Okay, that is also a progressive atrophy. So here it is only one side of the face, not the whole body is affected in Parry-Romberg syndrome. Only one side of the face is affected. That is called hemifacial atrophy. Okay, so it's a localized form of scleroderma. And let's see what's the reason why this atrophy happens. Why there is a atrophy of one side of the face. Okay, so they say that there is some kind of cerebral disturbances from the brain, some kind of stimulations are not coming to the face. Okay, so if an area is not innervated, what happens if an area is not innervated? There is no sensation. Okay, there is no stimulus coming to that area. So progressively, what happens is that when it is not stimulated, the muscles or the tissues or the fat or any structure, when there is no neural innervation, it tends to get atrophied. Okay, that is like a disuse theory. Okay, it is getting atrophied. So it is supposed to be a activity or inactivity of the sympathetic nervous system. Okay, and some authors say that it is due to some vascular causes. So the blood supply is reduced to that area, so that it is getting atrophied. There are different theories. So you should know that it is some kind of neural theory and a vascular theory is there. Okay, now coming to the clinical features, how you manifest hemifacial what atrophy. Okay, and it's mostly seen in women. Okay, mostly seen in women, and mostly which side of the face is mostly affected? Your left side of the face. Left side of the face is affected more than the right side, and you can see that there is a face here. Okay, we have a face here, and imagine this side of the face is affected. So here it is, there is atrophy. Here you have atrophy on one side of the face is affected, and you can see a line of demarcation, a line of demarcation. Okay, that line of demarcation is between the normal side and the atrophic side, and that line of demarcation is called Coupe saber. Okay, Coupe saber. So there is a line of demarcation that is called Coupe saber. Okay, Coupe saber means that saber is an animal, right? Tiger like an animal. Okay, so swish by or a claw by a tiger. Okay, just like that. and there is atrophy of soft tissues of one side, that is your muscles, your fat. Okay, there is soft tissue atrophy. And what happens when the fat is atrophied in your eye? Eyeball goes inside. Okay, the eyeball is placed in correct position by the muscles as well as the orbital fat, periorbital fat. If that is getting atrophied, what happens is that the eye will go inside, eyeball will go inside. That condition is called enophthalmos. Enophthalmos, eye going inside. What about exophthalmos? Exophthalmos means eye coming outside. Okay, so there you see enophthalmos and some kind of neurological disorders. What are the which neurological disorder you see in Parry-Romberg syndrome? Your trigeminal neuralgia. Okay, your trigeminal neuralgia that you see. Okay, now let's see what are the other oral manifestation. Okay, in oral manifestation, what you can see that the tooth is incompletely formed. You know that that is atrophy. Hemifacial atrophy is there. So atrophied side, okay, on that side the root is incompletely formed. There is a delayed eruption, and there is severe facial asymmetry in the patient, and there is delayed eruption. Okay, now let's see what's the treatment. How can you treat this patient? There is no treatment. Okay, most of the developmental anomalies we can't treat it because it is coming by birth. Okay, coming by birth, so there is no specific treatment for this hemifacial atrophy. There is no specific treatment. And one another small syndrome which I would like to discuss here is that you all have heard about a Pierre-Robin syndrome. Okay, Pierre-Robin syndrome. Now, Pierre-Robin syndrome is an examiner's favorite question. Either they can ask in your university paper or they can ask in your vivas. Okay, Pierre-Robin syndrome. It is frequently asked question. And there's an easy way to remember Pierre-Robin syndrome. There is no need to by heart a syndrome. You can easily remember a Pierre-Robin syndrome and easily score. Okay, so what's there in Pierre-Robin syndrome? There is mandibular micrognathia. See this child, you can see this picture. The mandible here is very small. Okay, very small. Micrognathia. Micro is small and gnathia is jaw. Right? Okay, small jaw. The mandible is very small, and the glossoptosis is there. What do you mean by glossoptosis? Glossoptosis. Gloss, you can imagine its tongue, and ptosis of the tongue means falling back. Okay, falling back. It's falling. Okay, so the tongue is falling back. Okay, and there is cleft palate. So what all things are there? The mandible is small, the tongue is falling back, and there is cleft palate. Now, how to remember it? Okay, I will try make you learn like a sequence. Okay, don't remember by heart it as a syndrome. Try to learn it as a sequence. So what happens in Pierre-Robin sequence? See, there is a retruded mandible or micrognathia. Okay, so remember that in Pierre-Robin sequence, there is mandibular micrognathia. So what happens if the mandible is small? Okay, if mandible is small, tongue is connected to the mandible, tongue will go back, right? Mandible is small, so the tongue connected to the mandible will be placed very posterior, right? What happens if the tongue is placed posteriorly while the time of development? You know that by 8th week of intrauterine life, the tongue will descend down and it will help the palatal shelf fuse, right? What happens if the tongue is not descending and is kept at the back position itself? The shelves cannot fuse, right? The tongue will prevent the palatal shelf from fusing. So if palatal shelf do not fuse, you get cleft palate. So this is what happening there. The mandible is small, the tongue is falling back, and it will prevent the palatal shelf from fusion. So what happens? You have cleft palate. Okay, and what a tongue is falling back and it will close the airway. Okay, so there is airway obstruction. The child will be having airway obstruction. Okay, so this is what you see in a Pierre-Robin sequence. So it learned as a sequence. Mandible is small, tongue is kept posteriorly, the tongue kept posteriorly, so it will prevent the palatal shelf from fusing. Okay, so it's a sequence of events one after another. Okay, that is Pierre-Robin. Okay, so that's about the two syndromes regarding your developmental anomaly of the jaw. So just see interesting your competitive exam level questions. Okay, learning this syndromes, how it will help you in your upcoming NEET competitive examination. So see, Pierre-Robin sequence include all except. Okay, so all except what are there in Pierre-Robin syndrome and which is not there. cleft lip, cleft palate, micrognathia, glossoptosis. Which is not there? You have cleft palate, but cleft lip is not there. So answer is option A. So this is how we learn. Okay, so cleft palate is there. That's not cleft. Okay, so that's all for this developmental anomaly of the jaw.